Hi there, welcome to my YouTube channel and our ongoing discussions about psychiatric disorders. This is kind of a summary video of all the videos I've done thus far about our Mental Disorders Explained kind of channel. And I wanted to kind of like tie together some strings here for you. For those of you who've been watching the channel regularly, you can see the strings I'm about to kind of put together because you'll know the themes threading through all the videos. So I wanted to kind of start off by saying I'm very hopeful as a psychiatrist. I love what I do because I see people get better. I really do. I love it because I see people come to me in a place of crisis, despair, disempowerment, and I take them on the journey with me and their therapist. We go together to the place of empowerment, what we call actualization, and functionality. The combination of those usually leads to happiness or relief or growth. Nothing makes me more satisfied than to see someone go from that to that. That is so fulfilling for me as a psychiatrist. I can't tell you how good I feel when that occurs. Now, that's not an easy journey, as you can imagine. It's not easy for people to change their thinking. It's not easy for people to change their habits. It's not easy to get enrolled into a program of coming to see the doctor regularly, coming to see their therapist regularly, having to do the work in between sessions, taking medications that might give them side effects. That is not an easy journey, and I appreciate that. But what I want to emphasize is that we are with you all the way. My patients know this about me because that's just the way I roll. I mean, I kind of breathe this job with them because I really believe that we can achieve a good outcome. I just need to be able to convince them. Sometimes at the beginning, of course, they'll be skeptical. They've been to hundreds of other doctors and treatments, and they've got messaging from the system that somehow this doesn't work, or we'll try this. It's all very random. What I've tried to show in this channel, it's not random, actually. You have to be able to, as a physician, I think, be able to take a good history. I remember 30 years ago in medical school, I was taught that 90% of the diagnosis or the problems come from taking a good history. Not fancy blood tests, not scanners, it's taking a history. And you'll know that when you go to the emergency room or you go to the clinic, the first thing the doctor will do is talk to you. And that's really important because we're trained to look at the onset of symptoms as well as the variety of symptoms, and you'll be surprised how much information that can convey. And I want to say that if you do it properly, it's a very systematic process, and therefore you can kind of distinguish one diagnosis from the other, which is what I said was my aim at the beginning of this channel. Now, that's not always at the beginning. Patients will come to the office and say, I need a diagnosis. I need to know my diagnosis, as if that is the catch-all. That is not how doctors are trained. Maybe the public wants to know that, but I think they place much more significance on the diagnosis than they do on the gamut of symptoms, which for me now, at this stage, 30 years later, outlive the textbook. They've outgrown the textbook because the textbook has just got these kind of stereotypical things, and there can be what we call atypical presentations of disorders. There can be kind of classical presentations, but they may not meet all the criteria. And so the DSM has its limitations. It's primarily used for billing and coding criteria for research and drug development, but it's not necessarily helpful for patients at the beginning or even during their treatment unless you've captured sufficient what we call comorbidities, that you've got all the diagnoses that are covered, that will cover the range of symptoms that seem to be presenting. We were always taught parsimony in medical school. In other words, if one diagnosis can explain it all, then give that diagnosis, kind of Occam's razor. The simplest answer is usually the best. Now, that said, psychiatric diagnoses are not easy. They can have complicated presentations, and you can have lots of comorbidities. I've learned over the years that anxiety and ADHD can go together hand in hand, and they look like each other, and they sound like each other, and one makes the other worse. It's a real conundrum for us as clinicians. But I think, if I may convey, patients may attribute too much to one disorder. So, for example, patients will talk about having a sleeping pill for a sleeping disorder. As doctors, we were taught that most sleep issues occur from undertreated disorders that can kind of spill over into that part of the day. So classically, anxiety disorders cause sleep. Certain obsessional kind of driven personalities, taking their work to bed with them kind of thing, up on the computer until late at night, teenagers playing video games, can be very kind of hyper aroused and kind of like overthinking and, not sufficiently relaxed to be able to allow sleep. And our culture hasn't helped that because it kind of has this array of, sleeping pills and melatonins and all this will get you to sleep as if it's like some zap that you do. It's not really supposed to work that way. We have our lights on in the evening right up until 11 o'clock at night, and screens. I've talked about this before. But what I want to emphasize is that good basic habits give you the most power for any disorder, any psychiatric disorder, even medical disorder. So if I'm eating well, if I'm sleeping well, I learned good sleep hygiene habits, I've learned good eating habits, then I will probably be more well buffered against depression, anxiety, and stress. It's a bit like trying to run a car on an empty engine. Okay, it'll go. Its performance is not going to be great. It's eventually going to sputter and stop. And I think that people do that unwittingly when they are suffering. They don't realize they're doing it, but it's our job to point it out. So, for example, if you're really stressed and anxious, when your appetite goes out the window, you're even less likely to be thinking clearly. Your blood sugars are going to dip, you're going to feel dehydrated, and your threshold for stress will be even lower. So the next thing that comes along will tip you over, as it were, and you might have an irritable, aggressive outburst. It is completely understandable, but these things can be addressed and preventable with good habits from the get-go. I found, of course, that the younger the patient is, the harder that is, because they're trying to figure themselves out. That's part of being a child, a teenager, an adolescent, or a young adult, for example. I rarely have to say this to adults above the age of 40 because they've kind of got this down, so to speak, because of life experiences have taught them that. If they don't get a good night's sleep, everything's off the next day. They might as well just go to bed on time. Okay? So sometimes we have to teach the basics so that we can accelerate the recovery. And of course, I will give a sleeping pill, what I call a sleeping pill. For me, it's called a sedative. It's not a sleeping pill. For me, it allows you to sleep rather than kind of knocking you out. But there are medications I use deliberately for their sedative potential because I simply don't want people to be in the old bad habit of taking their worries to bed with them. And that's what people do. Sometimes you need a medication to break the cycle, sometimes before the patients even learned good habits of sleep hygiene. So I appreciate that. I know that because I see people every day. So what I try to do is break that cycle from my end at the beginning. Then that allows them to maybe have a good night's sleep or a much better one. And then they can participate in therapy more appropriately to learn good sleep hygiene habits. There's an approach to these things that I think patients may not appreciate at the outset, but as they continue their journey with us, they really do begin to kind of, learn the syllabus, the crucial details, which is why I put videos out there like this, because I'm trying to empower you to know that if you do this, this will happen, but if you don't do this, this will happen. I want to give you the appropriate choices. What I found with patients Googling things is that Google doesn't really help you that way. It's basically an assorted algorithm, machine learning AI, which will never beat a doctor, for giving you appropriate advice. And it will oftentimes focus on the worst case scenarios. It'll list all the side effects, one after the other, which can be particularly alarming for people. And I'm going to talk about this more in my next channel called Let's Talk More About. But essentially, Google has really not been helpful at all to patients because it overloads them with information, it overwhelms them, and it's actually unhelpful because it'll start a narrative in their head about what is actually happening, which may not approximate to what we are seeing as mental health clinicians on an objective lens. So I want you to be able to steer clear of Google if you can, because it doesn't give you that three-dimensional perspective. I've often had to say to patients, Google's not a doctor. I am. I do this every day, okay? So I want to give you the real deal, authentic advice. If something is common as a side effect, or it's problematic, or I want you to know about it, about a potentially rare side effect that could happen, but you need to be aware of it, I will tell you because I will give you that perspective. But I'm not going to list every single potential side effect in a rat, for example, that Google may do. And I find that we're having to do a lot of work and damage control that Google inflicts on patients in distorting their trust in medications, trust in the doctor, trust in the process, the time frames, and it makes things look faster than they actually can be. So that's my little quip about Google. In terms of the rest of what I was saying throughout this channel, you've seen how powerful our medications are. I know this because my patients tell me. Now, they do take time. There's no doubt about it. And you know what? Maybe if they worked overnight, maybe it would be too good to be true. Let's face it, right? There is a learning curve, a process by which you kind of gradually build confidence upon confidence upon confidence because you see progress building on itself. And that feels real. We are oftentimes taught the placebo effect, that we give them a sugar pill to someone and they'll go, wow, my depression's much better. It doesn't work that fast. And I know patients who are telling me that, I remember the past. And I had to dispel that myth. It doesn't work that fast, right? What was probably likely the case was that your own mood changed fast, but it wasn't the medication causing it. And that's because some people may have more changeable temperaments than others. And so I found dispelling the myths and misconceptions with proper education is really important, because I'm having to fight a tsunami of that as a physician. I know other physicians say the same thing to me, because people have various sources that they, maybe at least at the outset, trust more than folks like me. But as we get to know each other and as we gain some successes with the medication, we'll go through ups and downs with side effects and dosing, etc. That's okay. I view that as part of the course. In fact, that tells me more about you, in the sense that if, for example, you need higher and higher doses, that tells me your genetics are such that you're more tolerant of medication. And I'll often ask them, if you take a couple of ibuprofen, does that work for you, or you tend to need more? So it tells me about your ability to metabolize things. Some people are fast metabolizers, slow metabolizers. I'm getting to know you in this journey, right? So I like that process, because I get to know you more and more and more, both outside and inside, as it were, from the bodily functioning, and it makes me more confident in how I dose something, or whether I switch it or not, or whether I add something to kind of build on successes. I know that by the time patients come to me, they'll have been on a bunch of different medications, they've lost faith in doctors and the system, and appointments are too short and all this. I just don't do it that way. I'm just telling you how I do it. I don't like to kind of upset the apple cart if they're coming to me on a bunch of different wrong medications. What I'll do, as I said before, is I will try to build on the successes. And we do oftentimes see what we call partial response, a partial success. I don't want to undo that. That means a lot to me, and I know it means a lot to the patient. But of course, they're wanting more because they want to have a complete functional repertoire. Absolutely, I say. I want to build on that. And so what I'll do is I'll say, okay, rather than switch it to something else immediately right now, why don't we try and build on it? Now, that's not always applicable, because of side effects. If the side effects is particularly debilitating, why would they trust me to go up and up on the medication? There's just no point. I know when to cut my losses and to change the medication up. What I want to say is that there is so much that the medications can do, from my experience. If I could convey that from the rooftops, as it were, with a microphone, I would do that, because I'm so enthusiastic that they do work. And I don't like the way that our advertising culture tends to overemphasize side effects. It never says somehow on Google, I was just musing here, but it never says, oh, millions of patients have responded to this. These are the trials that prove it. We've used this medication for decades. The side effects are there for some people. We'll check as they happen. I just don't see the advertising culture that way. I see lots of long, unpronounceable words on the adverts, but if I can't pronounce them, how can any patient even understand what we're talking about? So I want to be able to say that, take the media and their perception of mental illness and treatment with a large sack of salt, I say, because they've done a kind of a stereotypal job. So they'll equate mental illness with violence, which is, again, something that's actually quite rare. I know this because I've practiced psychiatry with such populations and in outpatients. And the vast majority of patients are not violent, including those with schizophrenia. They will overemphasize certain disorders over others. ADHD is way overemphasized compared to anxiety. And yet, if I use an ADHD medication first, I'll be giving people more panic attacks. I know this because it happened in the past when I thought it was ADHD, and lo and behold, there was a panic attack. What I'm saying is, there seems to be like a lopsided overemphasis on certain diagnoses over others. Bipolar disorder was really over talked about 5 to 7 years ago. It's kind of like come down a bit because people realize it's kind of being overused and entered the popular vernacular. But does it mean it doesn't exist anymore? Of course not. It does exist, and I treat it. But I don't go by the fads and fashions of the media. Schizophrenia is hard to treat, and it takes a long time, and it's very devastating for some. But again, it's also treatable, because schizophrenia is a very large word, as I said in my previous video. But along the way, it could look like other things. It could look like autism. It could look like bipolar disorder. It could look like anxiety. It could look like depression. And there are various different diagnoses along the way. That I expect, because it's how the disorder evolved. So for us as psychiatrists, I think the most important thing is the course of the disorder. Sometimes arguably more important than even the symptoms, because that tells us, oh, it's more likely to be this disorder than that disorder, right? If it comes on abruptly, if it comes on slowly, if it comes on intermittently, if it's kind of gradually affecting your functioning so you're going downhill, or if you're yo-yoing around a certain line, or if it's persistent. Those are the kinds of crucial gold data for me that help me make accurate diagnoses. So I hope this roundup is helpful, because I want to say that if we put our heads together for this, the patient, myself, therapist, chime in the medication, of course, right? But if we combine these measures together, these interventions, I've got countless stories of people who've recovered well because of that. But it takes some consistency. It is a journey. It's not easy. It can be bumpy along the way. It can be exasperated along the way. But we're in it for the long haul. And I think if you realize that about your treating professionals, I think that hopefully that should give you a lot of hope and make you feel very supported, because this relationship with the patient is probably one of the most important healing factors in your recovery, because you know that someone's got your back. You know that someone knows what your symptoms are like. You know that someone's trying actively to treat your symptoms, albeit in the background. I call it think of it as your antivirus software. I say that because I don't want you to be focusing on it all the time, the meds. I want you to be focusing on you, on your interventions, and let the meds do their magic over time. And patients will say, when I did it that way, I didn't get as angry. I don't feel as depressed as 3 weeks ago. But I don't want to be focusing all the time on it like a seed that you planted, you keep pulling it out of the ground. So there's ways to approach this. I really believe that there are approaches to treatment, recovery, and kind of maintaining a good functionality that do work. But we have to know what they are, and we have to practice them consistently. The number of patients who've told me, oh, yes, I know about coping skills, I know about deep breathing. I'm like, do you know why we're talking about this? Because I don't want you to just pass it off and dismiss it as if it's just a word. You need to use these coping skills when they matter. 2 a.m. in the morning, doctor's not around, you're out of the country, you ran out of your meds. What happens then? I really want to be practical about that, because these skills will help you wherever you go, whoever you're with, and whatever time of day it is. So I can't overestimate how important these skills are for managing everyday life. I think all of us should have these skills. All of us should have organizational skills. All of us should have self-soothing skills. All of us should have social skills. All of us should have time management skills. All of us should have problem-solving skills. These are skills, no matter what happens and what stage of life you're at, you'll need them all. You really will at some point. So I'm still learning every day. I'm a human being. I'm not just a psychiatrist, I'm a human being. I'm learning and growing every day. And if I make mistakes and fall on my face, I get up, dust myself off, and say, what can I learn from that? And I ask that of my patients. I ask that of myself. I ask of everybody, that we continue to be humble to learn from our experiences. I'm just telling you what mine were. So I'm rounding off this channel. I thank you so much for your support. Please subscribe and press the like button if you like what I'm doing, and so I can produce more videos of this nature that are helpful to you. But I'm going to be moving on in the next channel to things in more depth. So the channel's called Let's Talk More About, and that way I can go to really drill down on, for those people who are really interested in going deep diving, as it were, into the topic, so that it's not just an intro, it's actually kind of like giving kind of the details and important concepts that underlie our approach to these disorders. And I think it'll be helpful for those who really want to beef up their knowledge and skill sets and understanding of mental disorders. So I look forward to seeing you in that channel, and thank you so much for all your support along the way. I really do appreciate it. I'm so thankful that people have found it helpful. I'm just, again, giving you my experience as an everyday doc, but I'm so thankful to you that, that has been helpful to you in your day-to-day lives. Thank you very much. Stay healthy, and I'll see you next time.